Reflections by Hadofe. White Reflections, as you all know, is a show that delves into the complexities of life and modern day living. As much as possible, I try to bring people with real life stories and experiences in on the show to share the experiences so that people who are in similar situations can benefit and can gain one or two things from their experience. Joining me on the show today is Dr. Rolayo Ishola. First, when I met Dr. Rolayo Ishola, I realized that she had this irresistible charm. She had this vibe, this energy. She was. When you say somebody is larger than life, that's Dr. Ishola for you. She would literally enter a room and she would light up the whole place, and she's a fun person. She's fun to be with. And so when I got wind of her, challenge, I couldn't believe it. I mean, she waited for 10 good years, Dr. Ishola. You waited for 10 good years before you had your triplets.
Yes.
How were you able to pull that off? I mean, having to wait for 10 years before having, your kids, and then you were still living in the process. How were you able to pull that off?
Thank you very much, Kike. Thank you for having me on your show today. Really, I'll just say it's the grace of God. Because somehow, I really don't know, I pulled through, but I just believe it's the grace of God. I knew a lot of people said that, when they heard that Kuti, they're like, I never knew she didn't have kids, we never knew, but I was like, you don't carry your worries on your face, really. We try not to. It's not like you don't think about it, but, you just try not to. Then there's this Yoruba proverb that says, Maku kikutode. Like you don't put yourself in that way, because I believe that when the kids come, do I want to be healthy and fit to raise them, or I want to be ill and out of depression and all that? How do I want to pull through with that? So I just, and definitely I also just knew that God will never give up on me. There's something called hope and faith, which I strongly hold on to. And I just believe that I can't be barren. I will definitely have it. And they always say that delay is not denial as well. Some people can say it's easy to say, but waiting 10 years to say this, I really believe in those words,
Well, I had to ask that question because I was in that situation for just 2 years. I mean, after I got married, 2 years after I got married, a lot of people, even family members that you had not even expect to ask you questions would be alpha, that kind of thing. I think I was kind of pressured because of my own family dynamic and all of that. And in those 2 years, it was pretty bad for me, because in 2 years I had 3 miscarriages, and with every pregnancy loss, it was as if it was more like the death of a child, because as soon as I get a test done and I know I'm pregnant, I'm already, emotionally invested and attached to that embryo that is growing within me. And so anytime I'm told, oh, this pregnancy is not viable, we can't find a heartbeat, it's almost like, oh, somebody is dead. I mean, I've lost a child. Sure. So, and with the third one, it was pretty bad, because I was long gone. I think I was almost 3 months, and I remember the sonographer saying to me, oh, this pregnancy is not viable, we cannot find a heartbeat. And he gave me 2 options. We either go in there and evacuate like a DNC, or we give you tablets to make you bleed out. And I wasn't even in the mood. None of those options appealed to me. I just literally wanted somebody to say to me, oh, there's a heartbeat, but that didn't happen. And I'm saying this because looking back now, after I've had my daughter, I realized that everything had stopped for me at that point when I really wanted a child. Every single thing had stopped for me. And I did know that I went into depression in a very short time. So what was it like? Were there times you went into depression, you were depressed, you felt really, you lost everything? Were there times?
Sure, there were times, that you do feel bad,
Were you ever depressed?
No.
You were never depressed?
No, I was
Wow.
never depressed.
Wow.
Even when I had miscarriages, yes, I will be upset.
You had miscarriages
yes,
along the line?
Yes.
How many, please?
2.
Wow.
Mm-hmm. There were just like, they'll tell you either you want to come in for evacuation, depending on the state, the trimester you're in. So that time it was I was just given a tablet to take, and it was just more or less like you contracting like you're in labor, just to make sure you empty the uterus, and you're gonna like bleed it out. So that night, I couldn't even sleep in the room. My husband, I was in the other room. I didn't tell him, because if I told him, he might be really up and worried. And also, I just took the medication, and I was in the guest room, and I was just contracting away in serious pain. In serious pain. And I was like, God, why do I have to go through this? But I think there's sometimes you go through some things so that you can have testimonies and things to say, just like now, like we're sharing this, yeah. But depressed, I was never depressed at any time.
Wow, that's a good one.
Then I must also say that I had very good support from my family, my parents and my in-laws. They were fantastic. They supported us in everything. They will just say, oh, hope you guys are you're going for medical checkups, and obviously pray about it. But pressure like what's happening,
what about pressure from friends?
No.
Wow. No. That's interesting. In our setting,
maybe
not
because
a single person asked you.
They will ask you.
Or not. Okay, now the point I'm trying to make is there are reasons why you can feel genuinely concerned for a friend. Yes, if my friend was married for 5 years without a child, of course I can ask genuinely, what's going on? Is there anything you exactly? That's from a genuine place. Yes. But there are people who cross the line, who cross the boundaries, and they're like, I mean, why are you smiling? She got all red corny. I've heard people say that. I have a younger sister who is married. There's always a line, so nobody ever crossed that line while you were waiting.
Well, no, because there were very genuine friends that would ask me that what was happening, and I would just be like, yeah, we're trying, just keep praying, and that's the answer I give them. But to come to me and say stuff like that, no, I can't remember that, but I really doubt it, because I feel that, for the fact that they know I'm a doctor, and obviously I should know what to do. Is either you go medical or you go spiritual, and I believe that they just think that because I'm a medical doctor, I should be able to sort myself out. So maybe that put that barrier there from them asking me or discussing such with me. But obviously, there were a few friends that that were concerned about it, like, hope you're doing something. I'm like, yes, just keep praying. I won't have to tell you.
So there was never any time you felt like giving up?
Was there? No.
None for 10 good years. So tell me, this last pregnancy, these triplets, yes. How did you feel when you were pregnant? What were the things? Because when I was pregnant, eventually with my daughter. Now let me use myself as an example. When I was pregnant, eventually with my daughter, I wanted to protect this pregnancy as much as I could at that time, and I was doing everything possible. I would Google my symptoms. I would, and because I remember my husband and I visiting the doctor, and the doctor said to him, for 3 months, don't move near her, don't touch her. But I even extended my own to 6 months. So when it's coming, babe, doctor has said don't touch me. 6 months, don't even come. That kind of thing. It was so bad that I was living for this pregnancy and then I was going to the hospital back to back. I can't remember the number of scans that I was just for me to be sure that it was still there. And I'm sure that was coming from a place of fear from all the things that I have been through. So with this pregnancy, this triplets pregnancy, what was it like? How were you able to pull through with all the, experiences that you've had?
Okay. I had the triplets with IVF treatment, I must say.
Okay. I was going to come to that.
Oh, yes. I had them with IVF treatment, which is an assisted form of fertility treatment.
Okay.
And I had a couple of that passed in the past years while, Some
Sorry to
feel.
cut you short, doctor. Was there any time you ever felt like, okay, having this naturally?
Oh, sure.
Oh, okay.
Sure.
So the first few years you were trying
Mm-hmm.
naturally.
We were trying naturally.
Okay.
Yes, before we started assisted fertility treatments. So I had a doctor, my fertility doctor. He's really sound. His subspecialty is actually in reproductive health. I knew him way back in when I was doing my house job as a young house officer. Yes, I was in his unit, and I really didn't. I just knew there were very few people in that unit, you know, and it was all about pregnancy, some very high risk pregnancies and all. I really wasn't so interested in it. Only if I knew I was going to be. I was going to be in that situation in some few years after. So you know, when I got married, and like about 7 months down the line, we were talking, you know, and it was like, "What am I doing?" I'm like, that was it. Isn't it too early?
7 months after you got married.
Like,
okay.
What am I doing?
So your doctor asked you?
Yes. Like, what am I doing? Like, what am I doing? You get? So it was explaining to say I was pregnant. I was like, no, I'm not pregnant now. Like, I was not telling him that. It's not, it's even 7 months, it's not to a year. You know, you talk about infertility when a couple, you know, is unable to achieve conception after regular unprotected sexual intercourse, you know, about at least 3 times in a week.
3 times?
Yes, you know, after like a year. And I was like, it's not been up to a year that, you know, so we just laughed about it. And we just said, and that was it. But, you know, at the back of my mind, I was like, what was happening? You know, but... So I just chilled, you get, and after then, I think we started like, okay, what was happening? After a year, we started, and you know, we're still going natural. After 2 years, we were like, okay, let's go medical, and so that was the beginning of our journey into fertility. So for the last treatment, I still stuck up to that my gynae doctor.
Wow, for 10
yes.
good years.
Oh, yeah, sure. Because when I went for the
just
first,
your gynae doctor.
Yes. When I went for the first visit to myself and my husband, and we discussed and everything. It was in one of the big fertility centers in Lagos. When he left there, we went with him to another fertility center, another big one in Lagos, before he started his own. So I was just going with him because I knew he knew his onions. He knew what he was doing. It was very sound, and he knew my history. So there was no point going into another center looking for another doctor. And I'm also a doctor, so we could work around it together. And he was updated. You know, it was updated. And I must say that there was a time that we even went abroad. But obviously, it was very pricey for any fertility treatment abroad. And I was like, it was the same thing we're doing here. So we came back home and we still, you know, I was like, it was the same thing our doctor was doing in Nigeria that they were also saying there. So there was nothing different. There was nothing new or different, particularly, you know. So we felt comfortable with him, and we just stopped to.
So was there anything different from what he had been doing?
Yes, you know,
this
medicine.
This
yes, you know, medicine, science revolves. There's also something new, something very new. Is it the new medications, especially medications and stuff? There's always something very different that comes in, even with the embryos, the storage and all that stuff. There's always something very different, which he always brought up, you know, let us know that, okay, we will do this time around. There's something up now that we can try and all. But I know that for the triplets, we had a frozen embryo transfer, and also a frozen embryo transfer. That means, you know, that the embryos were frozen, and you know, when we're going to use them, they'll just store it, they'll thaw it, and you know, transfer into the uterus, into the womb. So then he also rested my uterus for like 3 months. There was this injection I was taking. It was just like he didn't want me to, you know, no periods, nothing. So I was put into a menopausal state with that injection. So which was very, very good for me anyway. So when it was time to have the treatment itself, you know, I started the injections. Then we had the transfer,
So what was it like when you were pregnant?
Well, you know, after several IVFs,
were you really afraid?
Oh sure. After, you know, several IVFs, you know, failed ones, you know, you just be hopeful as usual that God, let this just pull through.
Oh, okay.
Let this just pull through.
So
that was
at
always
what
my
point
prayer.
would you know?
You know, even for
The
For
first 4
IVF,
weeks?
no.
The first 6 weeks? For
No.
IVF?
No, for
because-
IVF, the medications, when you take it, sometimes you even feel pregnant without being pregnant.
Wow.
You're already feeling nauseous, you're already feeling all sort of things, you are not, you don't want to smell anything, they irritate you, they make you want to throw up. So to you, because there are some of the medications they give you that just make you feel pregnant. Yes.
Okay.
So you don't want to rely on that until you do your pregnancy test after
And
like, I think that's like 3 weeks of, I think 14 days or 3 weeks after, depending on the treatment plan you have. So I think mine was at it was supposed to be 14 days, but trust me, that 14 days was like 1 year.
1 year.
So
and you already had all those symptoms.
Yes, I had all those symptoms. So my husband was already like, I'll just buy the strips. I can buy like 20. Like, I just start testing them. Early morning urine, I start testing them. It was like, you shouldn't, like, I should not test
they kept coming out negative?
No, they kept coming out positive.
Positive,
For the
okay.
triplets, they kept coming out positive. So you see the line, to be faint. So when I do it the next day, to be a little bit darker than the, so I was like, okay, this seems real.
Like there's a progression.
Yes, but I couldn't tell him, because if I told him, he would be with me, he would make sure I don't get so anxious going over and over to do the PT and all. So I think I was supposed to do it maybe 5 days. I started doing it 5 days earlier. So I just called my doctor. I was like, this is what is happening. I sent him the picture. It was like, okay, I should go and do my serum PT. So I called.
What's that? Sorry.
Okay, that's blood pregnancy test with blood, not the urine.
Because that's more reliable.
That's more reliable.
Okay.
So I went in to do that. I called a colleague, not a colleague, a family friend, a lab scientist who came in to take my sample from me at home. And, so I did the HCG and the serum PT, and it was skyrocketing for that time
that frame.
Yes,
that
there's a range for a particular trimester. There's a range, so for me getting that very high value, I knew it wasn't one fetus.
Exactly.
I knew it was more than one.
And there's something they call you get positive pregnancy test, but I don't know, I can't remember the name now, but you're not actually pregnant in the real sense.
Yes, that is that. There's so many situations when you actually do that. So many situations.
Okay,
so when but this actually works with values.
Okay.
So the value was increasing. I did it on, let's say day 1. I did maybe you have like 10,000 international units.
Wow.
Day 3 when I did it, if you're actually pregnant, it would double up, but mine actually tripled up. So I knew, okay, this was more than one. This was more than one. So it was like, congratulations. Then, my husband and myself, then we started going in for the scans. Even with all this, my darling, with all this at this stage, the fear is still there. Because the chances are there that, are we going to pick the fetal heart sounds? How many are we going to pick? Exactly. So we went in for scans. The first scan, it was, there were 4 sacs. We couldn't pick the fetal heart sounds then. It was too early, but at least we saw the fetal pole and the sacs. So we went back again for the fetal heart bits. So they picked the 3 fetal heart bits and all. So obviously we were happy.
What was it like at that moment?
It was really nice. No, to tell you sincerely, when we're going back
in your journey so far, have you ever gotten to that?
Oh sure, yes. I've gotten to that stage. Even that time at the lounge, at the waiting room in the clinic, I wasn't feeling pregnant at all at that time anymore. I wasn't having all those early pregnancy symptoms that I was having in the first few weeks. So I was not feeling pregnant. I was so scared. I wasn't sure if they were going to pick a fetal heartbeats at that time. I was so scared, yes. And they picked 3. I just laid down there. And I do this eye contact with my doctor. And he's so firm, like, he won't even smile. He won't smile, he won't frown. So you can't make that decision. You can't even imagine what it's like. So I'm just looking at the screen, like the ultrasound, the screen, trying to see if I can even see anything. I couldn't see anything. I just was looking up into the ceiling. You get, but the embryologist gave in. She was like, so we're all very happy and.
Okay. So when you go back home.
Oh yes. The fear. Well, I just started being prayerful and just open. At that time, that's just what you can do. That's just what you can do, because it's not certain that you know, especially having failed treatments before. You've gone through, you've reached that stage before, and it failed. So that fear is still there, you know. But what you can just do is just, I was just very prayerful, and it was just strictly between myself and my husband.
Exactly, I was going to ask.
Yeah, it was just strictly between
myself. You
weren't
going to disclose to anyone? Yes, I get that part where you want to just make it really private at the beginning because you really don't know what's going to happen next. Yes, I get that part. So eventually, when did it occur to you that this was going to stay? This was the real deal?
Oh yes, when I got into my I think the fourth month.
Fourth month.
Yes,
you
because
never got to that stage.
No.
Wow.
I didn't get to that stage. It was always like the first 3 months. It was always yes.
Okay, so when you got to the fourth month.
Yes, and you know at that time I was actually on strict bed rest as well. Wow. Yes, then you know when you as women when it's a strict bed rest, you're like, okay, there are no kids in the house, no one is stressing me, I can stay at home, no one. But that's not strict bed rest, my dear. Because you stand up, go to the bathroom, go to the kitchen. It's not stress. I just want to go and get water. I just want to, let me just get something ready for my hobby before it comes back. But I was just like, okay, this time around, I'm going to give it everything it takes, especially when there were multiple, when I knew I was carrying multiple pregnancies. So I just went in straight to the hospital for strict bed rest. So I was there for I think from the 3rd week when I knew that, yes, it was, after that time we had the fetal heartbeat and all. So we just went into the hospital. I was there till the 4th month.
Wow.
Yes.
So you were in the hospital for how many months?
I think about 3 months or thereabout. 3 or 2 months, I can't remember now.
So I want to ask you, your husband, in all of this, how was he ever affected? No. And did he ever show it? Are you sure?
Well, he showed it. There were times when I had, with each IVF treatment, it was challenging because there were times when
the emotional
health-wise. Yes, the side effects from the medications, the side effect from even the egg retrieval. There were times where I would have what they call OHSS, that's ovarian hyperstimulation syndrome, when they're trying to when they're trying to retrieve the eggs either for storage or for fertilization So most times when I do that, I just always come down with complications that I might be in the hospital for 2 weeks, with ascites and so many things. In all, it was always just scared for my health. Okay, we're done. We're not doing this again. And I would be like, yes, we won't do it again. But obviously, let me just get better because that's what just needs to air at that time. Because it'll be you just have to leave. You being alive is way more important. You get. So I'm like, yes, that we won't do it again. We won't, but believe you me, let me get better. Another 6-7 months, and we're like, let's try again. Let's go back and try again.
So he wanted it as much as you wanted.
Yes, he did. But a man will always be a man. They will always hide their feelings. They won't want you to see that they are scared as well. But I know definitely those times it was always so scared for my health.
And so now with the triplets.
Now.
I do. But I just want to hear from you.
Yes.
Now with the triplets, what has changed? Yes, I want to know because, sometimes we want this so badly that when we have it, would want to, be grateful for those times we didn't even have kids and we had our lives. I'm just saying this and I'm being truthful. So what has changed?
I don't have my time anymore. But believe you me, my dear.
You would give that for anything?
For anything. Exactly. I don't have my sleep anymore. That has gone out the window.
I know,
but you wake up every morning with those beauties by your side.
Gifts, yes.
It's just so fulfilling. Motherhood is such a very priceless and a very prestigious position that every woman who actually desires it should experience it.
But if you desire it and you're not getting it, are there options? No. Yes. Now I want you to talk from the past, from the angle of a doctor, not as somebody who has, experienced this, but from that perspective. That's your professional, a professional angle.
Yes.
if you do desire it, because I know there are women who cannot even have their own kids naturally.
Mm-hmm.
I have friends who have medical conditions that, they already know, they've been told that they cannot have their own kids naturally. So if you fall into that category of a woman who wants a child, who desires to have a child, but your body cannot,
Yes.
you cannot have a child naturally by yourself, what kind of advice would you give to such a woman from a professional angle?
Yes. Like I say, I'm a general practitioner.
Okay.
The first thing you want to do is to seek a fertility doctor, not a gynecologist.
Okay,
A fertility
so there's a
doctor.
difference
Yes,
now.
yes, there's a difference now.
So your doctor was a gynae?
Yeah, his specialty is in fertility. Yes, so
Okay.
you must be very sure that you are meeting with a fertility doctor. Be very, very sure about that.
Okay.
Because if you come to me as a GP, I could tell you one or two things, but you're not going to get the best. Yes, you won't get the best from me. But you have to be sure that the gynae you're seeing is, has that specialty in fertility. Yes, it's not all of them that have it. You have to be sure that wherever you're dealing with, that's his subspecialty, as a niche for that. So you want to be sure you're dealing with the right person, and there's so many options. Thank God for science. Thank God for God. There's so many options opened now.
Exactly.
Back then, even
we had limited options.
Yeah, we had limited options. But there's the egg donors, the sperm donors. There's fertility in IVF treatment. There's surrogacy, even up to adoption. There's so many options opened that you can decide what exactly you want. There's so many women that they can't carry that pregnancy. Exactly. But it's not like they have. It's not like but they have, their eggs are good, but they just can't carry the pregnancy. They might just need someone to help carry the pregnancy, or they can actually carry the pregnancy, but they don't even just have the eggs. But their uterus is fine. They can carry it, but they just don't have the eggs.
So if you don't have the eggs, what do you
can get egg donors. They are egg donors just like they are sperm donors. Wow. So you just have to be sure you're talking to the right person that can give you as many options as there is, and you can make your decision from it. And you just don't give up. You fail, you try again. You just keep trying. It's very expensive, but you just keep trying.
Exactly. I was coming to that. The financial aspect of
yes, it's very, very expensive, but I can't imagine what it costs now, but I can be very sure that
running into millions.
Oh sure. Because most of those medications are imported. They are not like ones I used were imported, I know. But I don't think we have that here. Most of them are imported, and we know what exchange rate is saying now. Aside that, even the storage facility, the science, the art of it itself, you need, specialists, the embryologist, the fertility doctor. Even the procedure is the highly standard one. The equipment are highly standard. You get, so it's not just the regular, so they're very sensitive. So they can't just be cheap. They can't be cheap.
So now I want you to talk about women going through this, and women who do not have that support system. You're so lucky that in our setting you had the support. You had a very good support system. Support from your in-laws, support from your own parents, and then good friends who are not so insensitive. But I tell you, if you put 10 women down, you can't get.
I know.
You can't. You can't even get 6 or 7. A lot of women have had it really bad in that aspect. It's either their in-laws are disturbing them, or friends are putting pressure, or even the husband,
even their sisters,
and people are asking them all sort of meaningless questions and all of that, not minding the fact that they also have this emotional burden of not being able to carry a child. So I want to ask, what kind of support is available for such a woman in our setting? Were there times you ever got to that level of seeking support? Yeah,
not support in that sense, but while just browsing you just find, maybe when you're trying to find out the complication, something, you just see TTC. Before I even understood what TTC was, I didn't get what it's trying to conceive. You just say TTC, and So if I just find myself in that group. Not like a group, but maybe they're talking about, oh, I'm going in for my day, something's planned, I'm doing this. So you just follow them and just listen to them and just it just give you ideas of what they are going through, and you just say yours as well. These are women from all parts of the world, so it's not like I even know them personally, and it wasn't like I actually searched for a support group, but I just found myself,
and it gives you that comfort.
Yes, you just read it, and you also just ask a question. Okay, I'm so now, I'm feeling like this, I'm doing this, my doctor is giving me this, so you just reply. Some will tell you, I did this, my doctor did that as well, I think it's good, I pray for good results, so people just say, but I can't remember the name of the group. Okay. I can't, but but in Nigeria per se, I'm not too sure. I don't think so. I don't think there's any. I'm not sure about that really.
Okay. So right now, can you give us the name of your doctor?
Oh sure.
Yes, and the fertility center.
Okay, it's Dr. Babatunde Odnikele. That's Origin Specialist Hospital. Origin Fertility. Okay. Yeah, on Instagram it's Origin Fertility Clinic. Origin That's ORIGENE.
Okay.
Fertility. I can't remember the handle.
Okay.
But his name is Dr. Babatunde.
Okay. For those seeking, fertility treatments and all of that.
Yes.
Okay. Thank you so much, Dr. Olayosha, for coming on the show. You've heard it all. So, sometimes some women have it really good, and she's had it good for good 10 years. The support system and all of that, and eventually she has a triplets. I know them personally, so I can.